is going to be a fun night. I'm having a conversation and getting to know my new friend, Dr. Carlos Natal. He's in Estero, Florida. My name is Will. I'm the Academic and Industry Relations Manager for District 5. So I help out with the schools in Florida, Mississippi, Alabama, Louisiana, and Puerto Rico, which we are excited that I got Puerto Rico. I'm excited to get down there and plan some trips or events for you guys. I work for Aspen Dental Management. We're the support organization that supports the over 800 dentist-owned practices around the nation. So our number one goal is to support the dentists so they can practice, keep all their focus clinically on the patients. We want the doctors to succeed because we're partners. So anything that they need, we want to partner with them to help them focus on the patients. So we got some questions that were sent in before the session started, so we appreciate those that came in. There is a Q&A function at the bottom of your screen, so if we're talking and you guys have a question that pops up, feel free to use that and we will get to those before the end of the night. And with that being said, Dr. Natal, I'll let you introduce yourself and we'll get started shortly after that.
Awesome. Hey guys, my name is Dr. Carlos Natal Deliz. I am the MCD or Managing Clinical Director at Aspen Dental in Estero, Florida. That's the southwest coast. I graduated 2016 from the University of Puerto Rico. Shortly after that, I went into an AEGD program for 2 years, and I've been currently employed with Aspen Dental for 2 years now. So I'm here for you guys. If you have any questions, if you have any concerns, if you want to clarify anything, I'm here for you. Let me know, reach out, and we'll figure something out. We'll talk. We'll make this happen.
Yeah, and at the end of the night, if you have any more questions that weren't answered, feel free to reach out to me. If you want Dr. Natal's email address, I'm sure he'd be happy for you guys to use that to reach out to him directly. With that being said, let's get started. So Doc, let's go back to 2016. You're finishing up your 4th year of dental school. You said you went into the AEGD program. What were you weighing when you decided to do that?
Well, for the most part, I think the reason why, my question, I wasn't 100% sure if I was ready to join the workforce. I felt like I needed extra training. So I decided to do something a little kind of like an extended school to make sure that I was ready to enter the workforce. So I did the AEGD program with NYU Langone, and that was a 2-year program.
Okay. So during that 2-year program, what kind of, I guess you were looking for some more experience and some more hands-on, what kind of things do you think that improved your clinical skills before you joined Aspen?
So for definitely, when it comes down to what the surgery part of what we learned, that was, for the most part, that was very much enhanced. What comes to restorative as well, and I want to say that the thing that was the most beneficial for me during that program was picking up speed. I wanted to make sure that I was ready in that particular sense. It's not, when you go to the workforce, I think it's in the back of everyone's mind that you're expected to deliver a certain amount of treatment in a certain amount of time. So I wanted to make sure that I had that handle, that I was, quick, efficient, that I was doing the proper treatment, that I was doing it right. And, I wanted to enhance that particular aspect of me, of my professional, waiting to put it that way.
Yeah, no, that's good to hear. So when you decided to join, you decided you did your 2 years of AEGD, now you're deciding I'm ready to join the workforce. Did you have any other options besides Aspen Dental, and then how did you weigh those, and finally, how did you come to the conclusion that Aspen Dental would be right for you?
So I want to say I had I I want to say like six different employers lined up. They were scattered all over the place. There was people from Indiana, there was people from Michigan, there was people from South Carolina, different parts of Florida, New York. But most of it's funny because I was considering jobs at New York and Florida with the same employer, with Aspen Dental. The other employers were different, they were different DSOs in different areas. So um, I did go to all these interviews. So I did have a kind of like a feel of what was going on everywhere. And eventually, I think what helped me make my decision was the fact that, for one, Aspen Dental is in all of these places that I just mentioned. So if I ever wanted to transfer, if I ever wanted to do something different in another location, I would have the liberty to do that. Second, I chose Florida because I am very family oriented. So I wanted to make sure that I was able to visit my family, constantly or consistently. Um, Estero is, I want to say, 1 hour and 45 minutes away from Fort Lauderdale Airport, and Fort Lauderdale does fly directly to San Juan. So that was, that was definitely something that weighed in a lot in my decision making when it came down to who I was going to choose. Um, that, and the fact that this was something greater than I was, so I wanted to feel in that sense that I could, if I wanted to make a change in my career, like, for example, location wise, I would have the liberty to do that without having to, like, I don't know, go through an interview process, go somewhere else. Things change from place to place. So I wanted to have, like, I'm very organized. So I like consistent things. I like to have everything set up. I like to have a pattern. I don't like things changing around me.
I think a lot of doctors are like that, and like doctor said, we're all those places he interviewed, but so right now we're opening our 43rd state, which will be Colorado. So we're almost everywhere. We're getting there. We're growing it, at a rapid rate. So that's a great point that you brought up, doctor.
It's finally open.
Well, it's not open yet, but we're opening it soon, and we have some doctors that we've hired, so it won't be too long before we get there. So, a great question. So, doctor, this question just came in. Looking back, would you rather still go with the AEGD program, or do you think you would have wanted to enter the workforce right out of school?
So this question was also asked to me a couple of months ago in in the past event in March. Um, in retrospect, I nothing. So I wouldn't, honestly. If I would have known the things I know nowadays, I would have chosen to enter the workforce. For the main reason, financials are always going to be a thing. Like, that's something that's always in the question. That's always in there. And as much as we would love to like put it outside and not worry about it, financials are very important. So the fact that I was doing a program, that I was having the same amount of workload, and I was not, the pay was not as good, obviously, for me, financials are super important. So if I were to go back, if I were to have that decision once again, I would definitely consider joining the workforce, mainly because I've also had associates in my office that are, just fresh out of school. And, for the most part, these doctors are not being thrown into the wild. Nobody's actually letting them walk into issues and without any mentoring or help. I myself have had now 2 associates, and I've always been there for them. I've been a great amount of help to them. And when I started working with Aspen Dental, I trained with another doctor that was basically my mentor, and it was a great opportunity. Like I would have considered going straight into the workforce if I knew the amount of knowledge that I know now. When it comes down to financials, I'm not talking about dentistry. That's something that with time you are going to manage, regardless of you doing an AGD or you doing, going into the workforce. But I would definitely consider, going into the workforce directly.
I appreciate that answer. I've talked to a couple dental students this week, and they're still trying to figure out which route they want to go. So it's good to hear how you went about it and what you think now, because that's some good information that I can relay on to them. We had this question that just came in. Says, hi, I'm a 4th-year dental student, and I'm trying to see when is the best time to start looking for jobs. When would be a good time to start looking / applying for jobs?
We're in October. Wait, yeah, sorry, this has been a weird year. So yeah, I would definitely say it's never too late to start looking into this. Like this is a decision that is not easy to make. Establish where you want to be. Start working on those dental licenses, making sure that you have all the requirements for them, and that'll be the first step. Once you have that under control, I would definitely start considering, looking for a job. It's never too early. It's definitely something you don't want to be surprised by. Like, let's just say it's May and you didn't do anything. Like, you don't want to be that person just because if you need the job, if you need to start, earning some money, you need to make sure that you are working proactively to get to that point.
That's a great point, especially the location thing. A lot of, if you know where you have to be, you should. We have a lot of students that want Florida. Florida, is a hot market right now, and that's not always. We don't have a lot of jobs that always come open in Florida. So if that's where you need to be, you need to get speaking to someone, whether it's with us or with another company or whatnot. Get with somebody soon and start seeing what's available. Now, if you're more open to where you can end up, you might have a little bit more time on your hands. But we're having a big virtual event in November for 4th-year dental students where we're extending offers and sign-on bonuses. So if you're interested in that, definitely email me. I can get you some information on that. But if you're looking to make a decision pretty soon, it's never too early. So. Anything to add on that, Doctor?
Yeah, definitely make sure that you're looking into that. I agree 100% with you. Make sure that you know where you're going. It's definitely a hot market in Florida. There's other states that are hot markets as well. Just make sure that if you know where you're gonna go or where you want to go, make sure that you start looking with time, so that you can get exactly what you want, or at least as close as you can. Okay, so that's something. Time is always very important, and it's never, as I said, it's never too late and never too early for sure.
Good point. This question just came in. Hello, what is your plan for the near future? Are you planning on continuing to work as an associate at Aspen, or will you do something else? Dr. Natal said he's worked with associates. He's actually a lead dentist, or what we call our managing clinical director, or MCD. Since we're starting, Doc, can you describe kind of what the difference is between an associate and a lead dentist with Aspen Dental, and maybe go into a little bit about how your day looks versus the associate, and we'll kind of get the ball rolling on that one.
So a managing clinical director is basically a dentist that is established in one particular office. With that being said, if you're employed in, let's just put it, I'm going to put it this way. My particular case, I was employed in the Estero office. So I've always been there for the last 2 years. I've always been there day in and day out. Basically, with that being said, I do have associates that come in and they work with me, but for the most part, it's going to be me in the office. I basically am the one that, let's just put it this way, from the front desk back, it's my territory, and then from the front desk towards the front, and we have an office manager that takes care of anything and everything that's happening up there. So I'm the one that makes the clinical decisions. For the most part, I'm the one seeing the new patients, making sure that everyone is getting treated, that the treatments are, you know, what we want them to be, and that we're, you know, making everything like that machinery go back there, basically. The difference between an associate and a managing clinical director is, for like, I think the biggest difference is going to be responsibility. So everything is going to fall back on the MCD. You're the person that's in charge of the office, to put it that way, the clinical decisions of the office. So in that case, you're the one that responds to it. Not that that's in any way bad, but yes, all that responsibility falls on you. And let's just say if you do have a floating associate, which in some cases happens, and this person is just, it's going to go into the office, they're going to do the work, and then they're going to leave. So again, as I said, responsibility falls on you. You have to continue treatment for the patients, basically. So you're the person that's seeing the patients day in and day out. A typical day in the office starts at around 8 o'clock, 7:45 to put it that way. We have a morning huddle where the whole team is, you know, teamed up in the back. We kind of start the day with a positive note, with, you know, with the right foot, and then from that point on, we have patients from 8 o'clock till 5 o'clock. The day ends at 6 o'clock in my particular office. So every office hours are going to change from place to place and from office to office. Basically, I have for the most part 3 columns in my schedule, which are going to be divided between new patients, productions, and overflow patients. And then my hygienist has a 4th column, which is called, well, the hygiene column.
That's a good answer. I think you went over everything really well. This question just came in, and it says, does Aspen let you do the procedures you want to do, or are you limited?
No, definitely not. I can answer that straight up. No, I'm not limited to the procedures that I want to offer. I'm not guided in any way to the procedures that I should be offering. So I have complete autonomy of what I do. I think that's something that I cherish a lot. It's just, you know, in that part of the equation, you are the dentist, you are the provider, so you are the person who is making the decisions, and you're the one who's executing the treatment. So yeah, no limitations in that sense.
Good. That's very good to hear. This question just came in. Hi, can you tell us why we should pick Aspen over another DSO?
Well, that's a tough one. I mean, I don't know what to say. I love my job, and I love what I'm doing, and I love the flexibility that I have. For one, that's always going to be super important. The support system that I have in the office and outside of it is amazing. You know, I work with a great POP, which is Dr. Dixon. He's a great mentor. He's always there to answer questions. Everyone that works with Dr. Dixon is very willing and able to help you out. You know, that for me is super important. I always want to feel supported. I rarely use these, you know, these helps that I have, but the fact that I have them gives me a lot of peace of mind. So I can tell you about my experience. For the most part, I haven't worked with any other DSOs, but my experience has been completely positive. I have nothing negative to say. Which is,
yeah, and I can't really add on to that because I've only worked with Aspen Dental. We can go over the benefits of what we can offer, and you can stack them up if you need to, but I have a good feeling that we'll come out on top. You mentioned 7:45 to 5. Is that every day, or, you know, do you have any quirks in the schedule or anything?
so the schedule in the office, for the most part, it's the last new patient is coming in at 5. So it's going to be an 8 to 6 schedule, Monday, Tuesday, and Wednesdays. Thursdays, we actually start at 10 a.m. and we end the day at 8 p.m. And then Fridays, we start the day at 8 a.m. and we end the day at 1 p.m. And then there's one Saturday a month that we have to, that we work.
Okay, and that's pretty typical. So, most Aspen offices will work 3 normal days, 1 late night, a half day on Friday, and 1 Saturday a month. So that's pretty typical of a Aspen dental practice. So thank you for clarifying that, Doc. You may not know this one, and it's okay, but what is the average salary for a first-year associate at Aspen Dental?
Well, you are right. I'm not 100% clear on this. I know that for the most part, they are offered a daily rate, which is essentially, it's an allotted amount of money that is basically, to put it that way, promised for the day. I think it's around $500 a day. I'm not 100% sure. I don't know if you can add on to that. But
Yeah,
kind of there.
you're on the right track. So the average salary is every doctor who works for Aspen Dental has a guaranteed daily draw, or what we call our daily rate, and you'll get paid that on a biweekly basis. It's between 500 and 600 on average. It's just dependent upon the areas you work. Some of the middle of nowhere places may pay a higher rate than, Miami Beach. So those are just some of the things to consider when you're interviewing or you're looking for the positions. But you guys will get that guaranteed daily draw. But what Aspen does for associates and lead dentists is there's a profit share that's also available. So, you can come in and get your daily draw, and that's guaranteed no matter how much production the office does. But if the office is successful at the end of the month with the average of the production and the collections, after your direct costs are taken out, your wages and supplies, there's a pot left where everybody can get a percentage. Well, not everybody, but the associate and the lead dentist can get a percentage of what's left. So, you have your daily draw, but there's also potential to make over that. So if you have any more questions about that, I can email you some charts that kind of break it down that might be a little bit easier to read, but that's pretty much it. While I bring that up, I think, Doctor, can you explain, we talked about that pot of production. Can you explain what goes into that production, at the end of the month so everybody can kind of see what a successful practice looks like?
So basically, everything is going to be measured on the total production versus the total deposit in an office. To put it like in simpler terms, everything is going to the same pot, to put it that way. What the hygienist is doing, what you're doing, everything is going to go to the same pot. And then at the end of the month, depending on how the office did, then there's a profit sharing at the end of every month. But basically, everything is going to be in the same pot. Whatever the hygienist is producing, whatever the dentist is producing, everything is going to go to the same person. It's kind of like a collective thing. This is someone else's production, the associate's production, the MCD's production. No, we're all working together as a team to make the office profitable and successful, to put it that way.
And so that leads to this question that just came in as well. As an associate in your office, what types of procedures would I be doing? Will I only be doing fillings and prophies?
No prophies. We have hygienists. So no dentist is actually doing prophies. The experience that I've had with my associates is I let them do whatever they feel comfortable doing. I'm gonna mentor them and tell them, listen, you're free to do whatever you want to do. I'm gonna be here. I'm not gonna leave. So if you need my help, I am there. Just let me know. But basically, it's whatever you are comfortable doing as a provider. So that's the key right there. It's what are you comfortable doing as a provider, and what do you need help with? So at the end of the day, you're going to be doing whatever in that bracket, whatever works for you. And you always, like associates always, for the most part, have a dentist, another dentist in the office that can help out. So it's going to be entirely up to you. You're the person deciding what you're comfortable doing and what not. My associates have always been, when the times that they've been working with me, I let them do whatever they feel comfortable doing, and if they don't feel comfortable doing a particular procedure, they'll let me know, and I'll take care of it. It's not a problem. We're a team.
And I think you'll find that that's how it, every doctor that comes into Aspen, we try to set up with a mentor in the office. And, we can, Doc, can you talk a little bit about, you started with us in 2018. I know it's changed a little bit, but how was the doctor development program for you coming on board in 2018?
So to be honest, the doctor that I worked with for that month, he's the coolest guy ever. His name is Dr. Alex Montero. It was just, what we did every day was, like, for the first couple of days, I would shadow and make sure that I was understanding exactly what was going on, how the schedule worked, how notes worked, all that. And then he unleashed me. He was like, here you go. Now it's your turn. Now you run the practice. So, but obviously he was there as well, as I mentioned. He never let me alone. So that's something that's super important to mention multiple times. You're not going to be alone. Like, that doctor mentorship program is not meant to, let you roam and fail gloriously or do anything in particular without any mentorship. So it was a great experience, in my opinion. I loved it.
Yeah, so coming in as a lead dentist, it looks a little bit different than an associate, but it sounds like you worked with a doctor for a month to make sure you were comfortable before you went and ran your own practice. As an associate, it's probably not after a couple days that you're kind of on your own. It's, from what I've experienced, it's about a month where you're shadowing, you're taking notes with the lead dentist, and then he's giving you some critiques on talking to new patients or procedures to help you develop your craft. So it's about a month long before you're actually having your own production chair and producing and seeing new patients and treatment planning. So it's a lengthy program that we offer, and I would talk more about that offline, and Dr. Natal can give you some information on that as well. This question just came in. Is it more or less recommended to work in Aspen as a freshly graduated dentist? Is the experience demanded too high?
No, as I mentioned earlier, we're not gonna, like, we are totally understanding of a patient, if a person, sorry, I was gonna say patient, if a person is a new grad, that's something that we will absolutely know beforehand. So nobody's expecting anyone to work at a particular workload. We're just, every schedule is built to the demands to the needs of every doctor. Even my schedule nowadays, like, my office manager knows that I want a certain allotted time for certain procedures, because, hey, let's be honest, like, it's not as easy to get up from an extraction and I don't know, see a new patient and an overflow patient than it is from a filling. You literally can't delegate anything from a filling. So you have to sit there. You have to, do the procedure entirely before you can actually leave the room. So essentially, all schedules are going to be varying according to you as the provider, because you are the one that determines what time you need for X procedure.
Yeah, I think that's a great point, and I'll just add on that we love bringing on new grad doctors, so we can help you guys develop your craft, and become lead doctors or owners if you want to. So we are going to go at whatever pace you need us to go to get you comfortable, like the doctor said, with whatever procedures you want to do. This question just came in, Doc. you're not comfortable doing a procedure, who does it for the patient, or do you guys refer out, or how does that work?
So yes, if by any chance there is a particular, so I as a managing clinical director, I already know what I feel comfortable doing and what I don't. So when I see new patients, I obviously there's things that I don't feel comfortable doing, so I will be referring out. Yes, we offer referrals. As an associate, if you are working with a particular dentist at that office, you can always hand it off to the lead dentist. If the lead dentist is not comfortable doing the procedure either, then at that point it would be referred. But nobody's expecting you to do a particular procedure that you don't feel comfortable doing.
Do you guys have any specialty that comes into your office?
Yes. Currently, we have an oral surgeon visit the office monthly on a monthly basis, Dr. Freeman. We used to have an endodontist, and now from what I heard today, now in December, we're going to have an endodontist coming in once a month to the office as well. So we do have specialties coming in.
Yeah, so what that means for you guys, as doctors, not all practices have specialty that comes in, an oral surgeon or endodontist. Our goal is to provide that as much as possible, but in some areas it's hard to get those specialists to come to our offices. But what that means for you guys is if there's a difficult extraction or implant case, a medically compromised patient, or molar endo, or retreat, instead of sending them to a doctor down the road, you can schedule them with your specialist once a month, and that goes into the pot, that we talked about earlier, that everybody gets a little piece of at the end of the month. So it's a lot of the times I hear it's better for the patients to keep them in-house. So after a root canal, you can do the crowns, or you see them for the post-ops. And so is that pretty much how that works for you guys, doctor?
Yeah, that is exactly how it works. For the most part, we want to keep as much as we can inside the office. So we do build a schedule for the oral surgeon. He comes in, he performs, and then he's gone. And if anything happens to any of the patients, obviously we'll be able to follow up with them. With the endodontist, it was kind of like the same thing as well. She would perform the procedures, and literally this patient, like that day was a crown prep day. Dr. Blanco had a patient, and then I had that same patient, and then kind of staggered. So we would be working on the crowns that same day. We want to keep as much as we possibly can inside the office. So yeah, it worked great, because even with, for example, medically compromised patients that need multiple extractions, and the oral surgeon is there, the oral surgeon will do his part of the treatment, and then after that, the patient is basically moved to another room so that we can deliver the dentures or the partials. So yeah, it works out pretty nice. It's a nice flow.
Now you mentioned dentures and partials. How does that process work, or is there an advantage to an Aspen Dental, with dentures and things like that we should talk about?
For sure. Correct me if I'm wrong. Every Aspen Dental office has an in-house denture lab with a lab tech. So with that being said, the bread and butter is going to be dentures, partials, and whatnot. They're constructed in the office, so we do have a lab tech that in any case if anything breaks or if it needs adjusting, you do have that help in the office as well.
Yeah, that's a great point. This question just came in, and you've been with us for 2 years. What are some of the advantages technology-wise that Aspen Dental can provide to potential doctors?
So great. The way that the offices are built, for one, is great. Second, we have basically the latest technology. So in every office, you'll find an iTero scanner. And we will have digital x-rays, panoramic x-rays. For what I know in the offices for my POP, we have lasers. They just came in a couple of months ago. So all of us have lasers. Most of the offices have CBCT. So all these are up to date in that sense. So no paper charts.
Oh, that's good. Yeah, and I think coming back, I think I heard that all the new offices are being built with CBCTs.
Yeah,
One of the biggest focuses or biggest areas of focus for Aspen Dental is implants. Do you do implants, doctor?
I personally don't. We do. The oral surgeon does it for us. So he's the one that
Is
works.
there is there any training that Aspen can provide for you to start doing implants if you choose you wanted to do that?
Before the pandemic, we actually went to Chicago for a training for implants. So that was the first part of the training, and then as you start restoring, because the first part of the course is to actually work with the implants, like restoring the implants, and then after that, you go to the training for placement of implants. So yes, there is opportunity of growth in that sense.
Yeah, and I'll add on to that is coming in as new doctors. Part of that doctor development program we talked about is implants. We put a lot of focus on patients are coming in and they're wanting implants. So by the first year, we want all of our doctors to at least be able to restore implants and hopefully place them. So I'm sure the pandemic slowed things down on that because I've heard a couple doctors tell me the same thing. But as soon as it's over, we're going to get you guys back and going on that. Is there any other trainings that you have been to, to help you do more procedures or expand your knowledge or your procedures that you offer?
Yeah, for sure. Right after I got hired, I was taken to Invisalign course. So that's something that we also perform in the office. It's actually it's one of the things that you would have thought maybe not, but yeah, it happens pretty often. We have a couple of patients coming in, and we do Invisalign for them, which is a great adjunct as well.
While we're on that, so doctors talked about some of the training that he's been provided. With the pandemic going on, Aspen Dental has decided to open up our library and offer free CEs. So if you go to aspendental.com aspendentalce.com/welcome. All you have to do is create an account and you have access for no charge to our library, and you can get those free CEs if you need those. So again, that's aspendentalce.com/welcome. And if that doesn't work, email me and I'll make sure we get you set up. This question just came in. Does Aspen offer loan repayment services?
Okay, so this is a difficult one, but I'm going to try and answer as best as I can. For what I know, yes. There is some areas that they do. I would not be 100% sure though. I think I'm going to relay that to you, but for what I know, yes, there is some areas that they
Yeah, so a lot of places have a really high need for dentists, and it's hard to get dentists to those areas. So if loan repayment is something you want to do, reach out to me and I can find out what areas are offering that and how much, and see if we can make that work for you. Those places probably come with relocation as well. So, it's out there if that's important to you, and we want to make sure that it's a right fit. So, if you want to know after what types of places that you can get some loan repayment programs, just reach out to me, after this, and we can go over that. So it's a good point, doctor. This question just came in. What types of programs or charities does Aspen offer to give back?
So there is one particular, which was interrupted, of course, with a pandemic. I know for a fact that we do have Day of Service, which is a day in June, which we only serve veterans. It's a day that's basically just that's what you're going to be seeing. Patients that need your help, that are in pain, that can't afford treatments. That's the day that we're going to be seeing those patients. You adopt one of those patients for your office, or I mean, not one. You can adopt them all if you want, but you know, it's a patient that you adopt, and then at that point on, you're going to continue to, you know, give that patient the services that they need, or they were seeking. I had a very nice, my first patient, unfortunately he passed not long ago. It was super sad because his daughter called the office to let us know, like he loved us that much, that his family, his entire family knew that, you know, all these things that we had done for him. Very, very grateful, man. And it's just a very enriching experience because you are basically giving back. You're treating these patients. Most of these people can't really afford treatment, and it's sad that, you know, after serving the country, you know, they can't get their health back, or get their life together in that sense. But it's very enriching. It's a very nice experience.
And yeah, that's a good point. So we do offer the free day of service that Dr. Natal talked about. We also do a couple mission trips a year. We're going pre-COVID on this, but we, you know, if that's important to you, there's a lengthy list of doctors and hygienists and dental assistants that want to do it. So, you know, they announce where we're going, and you submit your interest in, and eventually it'll work your way down the list, and hopefully you'll get to go. And we also have a mobile mouth mobile that travels to all the states we're in. It's basically a RV that has two operatories on it, where we ask a couple dentists from the particular areas or states we're in to come and work for a day to provide more veteran care. So we do have a lot of, you know, charitable days and you know, missions that we like to do to give back. So this question just came in. What type of insurance does Aspen contract with? PPOs, HMOs?
It's going to vary from office to office. So I particularly, we do offer HMOs and PPOs in my office, but that's not the norm in every office. So it's going to depend on it's going to depend on each office for one. And if you are working in an office that has nearby offices, they're obviously going to make sure that your umbrella of insurances doesn't really like overlap someone else's insurances, so that the demand doesn't slow down in one particular office.
Yeah, and I think that's one of the things you'll see about Aspen is, you know, we take pretty much every insurance that's out there, you know, and we have certain rosters of HMOs that we accept as well. And then for the patients that don't have insurances, what kind of options do they have, Dr. Natal?
So, we do have in office, we have financing options for those patients as well. Apart from that, if the patient by any chance does not qualify for those payment plan options, we do offer as well discounts, different discounts, so that they can ideally the idea of the whole discount is to make sure that the patient can actually get the treatment that they need. You know, we see many patients with pain, so we don't want these patients walking out, you know, because money is an issue. We want to avoid that particular aspect of it, trying to remove it from the equation, not avoid it. Remove it from the equation so that the patient can actually get the care they need.
Yeah, and that's a good point. That's exactly where I was leading you. You know, I would say about half the patients that come in don't have insurance. So, you know, the doctors do a good job of coming up with treatment plans. And then depending on what the insurances or the finances say, you know, the office managers will come to the doctor if there's any changes that need to be made, you know, with the plan that doctor comes up with to help get them over the hump financially to help them get the work they need done. Is that correct, doctor?
Yeah, exactly. We that's us as providers. We are basically just making sure that we're providing the treatment. But yeah, the office managers will take care of all the financials and whatnot, and help out the patient as soon as we can, or as fast as we can.
Do you guys take Medicaid and Medicare?
I don't think in my particular office we do. I'm not 100% sure. Again, this is going to be an office to office thing, so I'm not 100% sure, but particularly in my office, we don't.
So I'll add on to that. So Aspen Dental as a whole doesn't accept Medicaid or Medicare, and there's a few reasons why. One is, when we get our new patients in, we want doctor to provide comprehensive treatment plans, to get the patient back to health and coming in, 2 times a year for their cleanings after all the work is taken care of. Medicaid and Medicare will usually only take care of 1 or 2 things, and that's kind of not what we want to see, where we'll come in and do a filling or an extraction when they have so much other work they need. The reimbursement rates are really low. So we are a business, so as a business, it doesn't make sense for us to have Dr. Natal do a surgical extraction and only get paid, $25 or whatever that contracted rate is, And the third thing is it takes a while for them to reimburse. Dr. Natal will do that extraction and he may not see that for, a while when he needs, we want to make sure that all the hard work that Dr. Natal does is getting paid for, so he can provide for his family. So that's a few of the reasons why none of the Aspen Dentals do that. So good question on that one. This is one I don't know, doctor, so I'm hoping you can answer it, but how long does credentialing take?
Oh God, that's a tough one. I'm not 100% sure either. I'm sorry. I don't think it takes, actually, no. I don't think it takes more than 2 weeks. We just hired a colleague of mine, I want to say maybe 3-4 days ago, and her start date is October 19th. So I don't think it really takes that much time to credential any particular provider. So I mean, I hope that sheds a little bit more light on the question. I'm not 100% sure. I'm just saying this is probably something that doesn't really take too long, because her start date versus her interview date are like literally very close by. I think the interview was October 2nd and the start date is October 19th. And that was a set date. She set that date. So
I actually, I don't know for sure, and I can find out if you want, and I can exact number or days, but I know a lot of our offices need providers, so I don't think there's would be a lengthy process at all because of the patient demand. So that's another good question.
Adding on to that, it's nothing that you as a provider should worry about. It's something that's going to be actually done for you. You're just going to go in there and do your job, and that's it.
Thank you. So let's see. So this question just came in. After associate MCD, what opportunities do you have at Aspen? What's the time frame / requirements between associate and director, and so on to keep growing?
So that's a great question. I personally was hired as an MCD. I never went through the process of associate to MCD. After MCD, you can always either partner in an office, or you can actually buy or own an office, part of an office. I'm not 100% sure. I apologize. I think this is a question that you might be able to answer a little bit better.
Yeah, so I've heard, we had a new grad from 2020 that just started in July, and she's been an associate from July till now. So what is that? 3 months? July, August, September. Yeah, about 3 months. And she's been offered a lead dentist position at a new office that's opening later this year. So it's all about you and what you want. When you come in, you're going to let us know, you're going to be an associate. Mentorship is important to you. We're going to give you mentorship. And then, if you want more responsibility, and like doctor said, you want to be a lead dentist. When you feel ready for that, there's lead dentist positions everywhere. Now, if you want a particular lead dentist position, you may have to wait a while, but there's no time restraints or requirements that you have to be an associate or a lead dentist, and then like doctor said, there's partnership, if you want to stay in a certain area, but there's already an owner there, you can partner with the owner. Or if you want to build a brand and open multiple locations, you may have to relocate to an area that doesn't have owners, but you can buy the practices. So there's a lot of opportunities just from starting an associate, going to a lead dentist, and then even after lead dentist, there's a lot of options. So
adding to that, there's also offices that are already built. They are not working under any particular owner. So those are offices that are actually offered as, as buying or investment opportunities.
So we got a few more minutes here. Hopefully we'll get to all the questions, but this one just came in. Do you have a say in what equipment and supplies you use in your office?
That's basically, I need what I need. So yeah, I have the final say. So when it comes down, let's just put it as an example. I wanted a particular brand of composite. I know that's a little bit needy, but I wanted this particular brand of composite. So that's the composite that we order in the office. If I need any supplies, I'm always able to order these supplies. So that is definitely not something that should be worried about. You're going to have whatever you need for your office and to make your practice successful.
And I'll add on to that. Our biggest provider is Henry Schein. With all of our offices, we have negotiated rates. So, we not only can get you whatever supplies or equipment you need, but we get it at a really good rate. And we're the second largest, purchaser from Henry Schein outside of the U.S. government. So, if like I said, if you need something, you'll get it, and there's not going to be somebody that tells you you can't have it. So, you're the doctor. You need what you need to help the patients, and helping the patients is our number one goal. So, good answer, Doc.
Adding on to that, if there's anything in particular that you need and it's not on the catalogs, you can always put a purchasing ticket, and they'll get it to you. Trust me.
It's part of the support. Yeah. So, if you need something you can't find, we don't want you spending your nights or your days looking for it. Let us do that for you, and we'll get it taken care of so you can focus on the patient. So good point, Doc. This is a good question. What is the new patient exam like? And how do you manage that between the scheduled patients?
So you're always going to have a new patient column, or one or two. It's going to depend. There's a new patient column every day, and there's also a high needs patient column. So it's going to depend on your particular preference. My new patient exams are set up for 45 minutes. So to put it in a very literal way, the patient checks in. They will fill out their paperwork in iPads. We don't have any actual paperwork anymore. So the patient fills out all the paperwork, signs all the paperwork, and then at that point, one of the DAs will call the patient in. I'm actually going through it in my mind as we're speaking. So the patient will be called back. They will be asked the main concern. Full exam, the panoramic X-ray will be taken. The full mouth series will be taken. They will be seated in a room. We're going to do what we call the dental health scan, which is a scan using an iTero. It's going to be, trust me, this is going to be life-changing for any person that uses this, because it is an adjunct. It's an aid. You're going to show the patient exactly what's going on in their mouths. At that point, after the dental health scan, we have the hygienist come in. The hygienist will take a look at the gums, will probe, She will give the diagnosis and the treatment that the patient needs for the gum. And then at that point, you would come into the operatory and explain everything that needs to be done. You're going to write your treatment plan with your office manager, ideally in the room, so that the office manager will literally take the patient from that point to the consultation, explain costs, go over any financial options or any different options that we might have, or any different types of treatment that might be recommended for the patient. And then at that point, it's the patient either comes back for follow-ups, or he can actually have what we call a same-day start, which is essentially the patient starts the treatment that same day. I mean, with time, you're gonna get better. You're gonna there's some patients that have obviously bigger demands in what comes to their health. So, you know, you have to be you have to make sure that you have enough time to treat the patient that you have in the chair, plus, you know, seeing the new patient. I essentially, when it comes down to crown preps or to fillings, I like a little bit more time, a little bit more than an hour, maybe an hour and 15 minutes, so that I can juggle between them. Seeing the new patient, I only go into the new patient once the hygienist has been in there, once the scan has been done, once the x-rays have been done. And at that point, I literally go in, I introduce myself, I go over any particular treatments that needs to be done. I explain them thoroughly. I personally use the iTero a lot because I like patients to see what I'm seeing. I don't want patients thinking, okay, let me just, you know, I'll just trust him because he's the one that, you know, he's the provider. No, I want them to understand what's going on. I want them to see what's going on. So yes, that's going to be a personal thing. You're going to have to make sure that you can actually work between both things. But as I said, there is a scheduler. You're going to be able to have a say on how much time you need for a particular treatment. So that shouldn't be, you know, a problem at all.
Yeah, so when all of that is really good. And when you start, they're going to ask you how much time you need for fillings, extractions, crown preps, crown seats, you know, every procedure that you're going to want to, you know, do at the practice. And what I see when I was regional is the doctors would come in and they'd be like, well, I can do a crown seat in 30 minutes, or I can do a prep in 45 minutes, but you'll come in and you'll have new patients, or you have wax bite that you have to see as well. So when we, you know, a lot of the times we'll tell you, well, let's give you a little bit more time, because once you get into the chair of having the balancing the multiple chairs, you'll see why, you know, Dr. Natal might schedule a crown prep for an hour and a half, even though it only takes him an hour, you know, or, you know, I don't know Dr. Natal's time, but he's got to see 2 or 3 other patients while he's doing a crown prep. So there's a lot of things you'll come in and you'll learn, but we've seen it and we want to help you succeed. So we'll make sure we take care of that for you. So this will be the last question of the night, and then I'll let Doctor go over anything he wants to add, but this one just came in. You know, you do your treatment plans, Doctor. Do you have any quotas you have to meet every month, you know, in a particular procedure or anything like that?
No, not at all. I truly don't have anything else to add to that. Literally, there's no quotas that I have to meet. It's just, you know, you're there to do your job. You're a clinician. You're not an office manager. You know, you're there to provide dentistry. That's the only thing that you should worry about. And I am a sole believer that is how it goes, because I've experienced it myself. I don't have to worry about any of that other additional stuff. That's the difference between a DSO and a private practice. You know, you're a clinician and nobody expects you to be an office manager or a business manager in that sense. You're there to do the job, to pull the tooth.
And that's a great answer to end on. You know, like I said at the beginning, you're going to focus on the patient and doing what's right for the patient. The business side will follow. So this question just came in. I want to answer it because I appreciate all the questions that this person asked me during this thing. What does a complete team comprise of? How many hygienists, assistants? And I'll go through it real quick, Doc. We want most of our practices to have 2 doctors, 1 to 2 hygienists, 3 to 5 dental assistants, an office manager, 1 or 2 front desk people, and then 1 or 2 lab techs, depending on, the demand in the practice. So, doctor, any closing words, anything, you want to, all the attendees, the University of Puerto Rico students, anything you want to leave them with tonight?
So, for one, if you have any questions, feel free to ask them. We're here for that. If you have any questions for me, I'm always willing and able to answer those questions. Hey, I work, but I'll get to you as soon as I can. This has been a great experience for me. I actually volunteered to do these events with Aspen Dental because I enjoy what I do on a day-to-day basis, and I want to clarify as much as I can for other possible candidates, essentially what entails working for this great company. If you guys have any questions, feel free to reach out. I don't know if I'm not very technology oriented, but I don't know if there's any way that I can leave my email, my phone number. If you guys need to reach out, text, or an email, whatever you need, just shoot an email on my way, and I'll get back at you as soon as I can.
Thank you, Dr. Natal, and I'm grateful you're helping me out, because I could have answered some of those questions, but it's a lot better coming from a doctor, because this is going to be hopefully some of you guys as colleagues. So with his information, you heard him say it's okay to give out his phone number. So if you want his contact information, reach out to me. I will pass you that info along. And again, thank you guys for spending an hour with us, and hopefully it was worth your while. And we'll talk to you guys later. Thank you, Dr. Natal.
No problem. Thank you.
Have a good night, everybody.
Bye.